A 45-year-old male with a history of untreated schizophrenia presents to the emergency department after being found wandering on the streets in a confused state. He is malnourished and disheveled, with poor hygiene. The patient refuses treatment and insists on leaving, stating that he does not need any help. He is calm and not posing an immediate threat to himself or others at this time. The medical team is concerned about his capacity to make decisions given his psychiatric history and current state. What is the most appropriate next step in management? A. Allow the patient to leave as he is not an immediate threat. B. Obtain a court order for involuntary treatment. C. Request a psychiatric evaluation to assess decision-making capacity. D. Administer emergency antipsychotic medications without consent. E. Contact social services for long-term involuntary hospitalization. Please pause and write your answer in comments. Now let's find the correct answer. Explanation. The correct answer is C. Request a psychiatric evaluation to assess decision-making capacity. In cases where a patient with a known psychiatric history refuses treatment, it is essential to first assess their decision-making capacity. Capacity refers to a patient's ability to understand the relevant information, appreciate the consequences of their decision, reason about treatment options, and communicate their choice. Schizophrenia can impair these abilities, especially in cases of untreated or poorly managed illness. In this case, a psychiatric evaluation would help determine whether the patient can make an informed decision to refuse treatment. A. Allow the patient to leave as he is not an immediate threat. Even though the patient is not currently violent, the decision-making capacity must be evaluated first before allowing him to leave, especially given his psychiatric history and compromised state. B. Obtain a court order for involuntary treatment. This is a drastic measure and is not the next immediate step. Capacity evaluation is essential before involving the court. D. Administer emergency antipsychotic medications without consent. Emergency medication administration is only warranted when there is an immediate risk of harm to the patient or others, which is not the case here. E. Contact social services for long-term involuntary hospitalization. This step might be appropriate in long-term management if the patient is found to lack capacity and poses a risk to himself, but it is not the first step. Key takeaway. In patients with psychiatric conditions who refuse treatment, it is critical to assess decision-making capacity before proceeding with any interventions. Only patients with intact capacity can refuse medical care. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.